Hello there, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have a great friend, plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different procedures today. First up, we'll be discussing abdominoplasty. Then we'll get into breast augmentation, gynecomastia, I always forget that one. It's the eyelid lift. All right. Yeah. Before we get started, of course, any advice we give you today, consult your own physician. All right, let's jump right back in. Thank you for being here again.
So nice to be here.
Oh, it's so wonderful to have you here, and we love talking about all these things. Yep. But, you know, it's summer. Weather's getting warmer. People are starting to think about maybe, you know, I want to get a little procedure done and look a little better, right? After maybe they had a baby or whatever.
Well, we shed some clothes and we want to be able to look
Exactly.
nice.
We look in that mirror and we go, hey, I might try to improve something. So we're going to talk about abdominoplasty.
Okay.
So what is it first?
Literally means abdomen changing. So it's tummy tucks.
Tummy tucks.
Gets rid of loose skin, loose muscle, tightens up the belly, especially useful after weight loss or after pregnancy.
Exactly. And you do a lot of tummy tucks. I mean, they're big.
They're very
Breast
common,
aug, and then next is probably tummy tucks, right?
It's always in the top 10.
I love that. Yeah. Well, speaking of that, people love to see the pictures. So let's get right into them, because we have a lot of great pictures for you. So let's do picture one.
Sure.
Wow. What is going on here?
Our first lady lost a lot of weight.
Yes.
So you can tell when people gain weight, the skin stretches. And as the weight's lost, the skin doesn't recoil well often.
Exactly.
And we end up with this skin that hangs down.
Yes.
And it can cause problems. It can cause rashes, irritation underneath, problems in the heat. It sweats underneath there.
Exactly.
It doesn't breathe
Not
well.
comfortable at all.
No. So with a tummy tuck, we're taking care of the extra skin. Also can tighten up the muscle. So in this case, you can see that bulge at the top.
Yeah.
That's from the muscle being loose.
Oh, that's from the muscle being loose and lax. Oh.
Yeah, so it's internal fat pushing out, and the bulge at the bottom is skin that's folding over.
Oh, wow. Okay.
So not only do we get rid of the extra skin, but we tighten up that muscle.
Wow. All right, so you have a scar here. Now, what is a scar like on a tummy tuck normally?
So the scars usually run just below the waistline.
Okay.
And the length of it is determined by how much skin there is
really?
That's folding over. So in her case, you can see that fold comes halfway back, so the scar is going to go about to that position. If I stop early, we get a dog ear, which was an extra bump of skin.
Oh, really?
So we want it to be flat,
so you have to do it, so you have to take it.
Yeah.
Now, what is the downtime like for this procedure?
So before full activity, about 6 weeks.
Really?
Because I think most people, you know, when we repair that muscle, they want it to stay that way.
Yeah.
And if you're doing a lot of heavy lifting and such, it's about 6 weeks before that's really knit up. But in terms of walking, moving, you can do that right away.
You can.
Most people by the end of the week are feeling pretty good. By 2 weeks, are driving, moving around, doing everything they need to do, just not the heavy lifting.
Let's go to picture number 2.
Sure.
That is a beautiful job there.
Sure.
Okay, what's going on in this picture?
So same thing. So the abdominal skin is loose, and what we're trying to do is just tighten that up and make it smoother. And you may have noticed I've repurposed a little bit of that fat that we've taken away and put it in her booty.
That's
so we've done a Brazilian butt lift.
I love
kind of carve out a little bit underneath to give it a tighter curve to the back of the thigh. And then any of that extra fat from the front of the abdomen was then transplanted back into the buttocks. The nice thing about that is, and there's some evidence showing that if you move the fat, it kind of helps maintain the result. Because that fat where it's in the abdomen wants to gain weight first.
Seriously?
And if we put it somewhere else and you gain a little bit weight where you want it,
like
so much
in
the
the
better.
butt. That is
so much the better.
perfect.
Yeah.
Brazilian butt lift. That's wonderful. Now, let's go to picture number 3, because we have an email from Barbara in Castro Valley.
Yeah.
She writes that she is pregnant right now. She's going to give birth, and then she's going to want a tummy tuck. Now, can she get pregnant again after she has that tummy tuck?
She can, but it may stretch out the results. So we usually advise having children
your babies first,
and then have the tummy tuck. That way you keep the results.
So think about the family first.
And this is a lady who had a baby, so this is a mommy
okay.
makeover. So tightened up the abdomen and also done a breast lift. So no implant, just repurposed the breast tissue that's there, lifted it up, bring the nipple up higher on the breast.
And I love how everything looks natural. I mean, that is a beautiful natural result. And you can do several procedures at once. If you're going to get a mommy makeover, you say? You could...
Mommy makeover, usually it's the breast and the belly together. And sometimes we'll add a little lipo or something else. But
and,
for those, I keep people overnight. As we start doing more procedures, I want to be sure you're safe. So I want to keep you overnight, make sure you're recovering well.
Let's do the next picture. This is amazing, because what a difference here. This is such a natural look on the right side. What did you do?
So this is someone who had a lot of sort of extra skin, and it's kind of irregular and wavy. And it can happen with weight loss, can happen with pregnancy. Also, I can see it sometimes after people have had liposuction who probably weren't the best candidate, like they're kind of on that borderline, and after doing liposuction, the skin ends up irregular.
Just, really loose. Just kind of loose on
And
that.
it wouldn't be something you go back and touch up with lipo.
Right.
In this this case, I did the full tummy tuck.
Amazing.
So
I love
it gets
that.
rid of that extra skin, smooths it all out.
And as we go to the next picture, just real quick, would that scar be less then, since you only had to do a little bit of loose skin?
The scar is just however wide
Whatever
the
you need to
laxity
get the
is.
skin.
So the wider the skin laxity, the wider the scar.
All right, next picture.
This is someone mostly muscle problem.
Wow,
So you can
that's
see the muscles
definitely,
just really
yes.
letting everything fall forward, repair the muscle, makes it flat. And even down in the underwear area, it's tightened, we've lifted that
Yeah,
up.
and that was just basically from having a baby?
Having a baby.
Wow, having a baby, and that's all you did on that one.
Yeah, just tummy.
Fantastic. All right, and our final picture?
And same thing. So this is someone who's very thin.
Yes.
I mean, she couldn't lose any more weight and look healthy. And she's still got this bulge, which
Yeah.
in a dress or something tight is kind of embarrassing. You want it to be flat. And with that, as much as she works out, she deserves to be flat.
Yes.
So what I've done is the same thing. Gone in underneath the skin, tightened up the muscle, made it nice and flat.
So it's like a corset. You're
It's
basically
like an
tightening
internal
it.
corset.
That's wonderful.
Exactly.
I love that. And that's all she had done on that.
That's enough.
Just the internal corset.
Took care of it.
What age is good for?
And you might think we could do a mini there, but
I know.
the laxity is above the belly button, so I really need to go above it and tighten it. Yeah.
That's it. Couldn't do it.
Sometimes you got to do more to get the right result.
And again, what's a good age for tummy tucks, or does it matter?
The age, obviously, after having kids is best, so usually it's folks who've already had their children.
Okay.
As far as maximum age, you have to be healthy.
Yeah.
So that's more important.
All right, well, thank you so much. We've got more on Body Beautiful coming up. If you want more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. We have lots more to talk about. What's coming up next?
Breast off.
Thank you. Breast augmentation coming up. Keep it right here on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.